All right, so the theme of our conversation today, of course, is mental health in lieu of contributing to Mental Health Awareness Month. I believe what our audience will discover through this panel is that mental health covers a broad spectrum of topics. So I want to provide a disclaimer to our listening audience to let you know we will be discussing the topic of suicide and other sensitive scenarios may be used today by our panelists in order to help us all gain a greater understanding on this very important topic. So let's get into the conversation. We have a phenomenal panel here with us right now. You saw in the intro their bios and what gives them the credentials to be here and to have this conversation and to contribute. So we're going to go right into it. And I just want to pose the question to you all around how do you believe the pandemic has affected people's mental health in general? And we're looking at March 2020 till to date, where the pandemic really took off. And I'm tossing that out to anybody. Let's jump in.
I think it was a gut punch for everybody. I mean, even as a mental health professional, I was like, wow, this is really different. And it was not just a physical strain of having to be isolated and to have to not be around family and friends, but the mental part of, I got to be in the house all day. I can't do what I normally like to do to make myself feel whole. And when you take that whole like chunk of life out, man, that wears on you. And I'm a very social person. I like to be around people, and not being able to be around people, it started to make me feel a certain kind of way. And I had to make a big adjustment for myself on how I was even going to adjust with this. So I think for a lot of people, it was like a gut punch that no one was expecting and no one had any playbook for. So that's my perspective on that.
Yeah,
I agree.
oh, go ahead.
I have yet to see the full effects of this pandemic on, just society's, the population's mental health in general. We've talked about this a lot, and I've heard that this pandemic is actually likened to, or could actually be classified as a disaster. The difference between this and many other natural disasters is that a lot of people were not able to go through the normal grieving process. So we have a lot of people that have experienced PTSD through out this past year, a little, but several things that had been be skipped or overlooked in the name of staying safe, in the name of survival. A lot of individuals lost family members. Were not able to see them before they died. Were not able to see them after they died. Were not able to. So the full fallout from this year, and as you know, as we get past the part of this pandemic, I think we're probably going to see a massive pandemic after.
Yeah, so we were losing you just a little bit there,
Okay.
Josh. But I think if I was to synthesize what you were saying, is that this pandemic could be compared to a natural disaster. And on the other side of this pandemic, I believe you were saying that we could expect to see some natural disaster recovery relief funds or something of that nature.
Or rather, the viral portion of this pandemic will probably something akin to a mental health pandemic, health conditions that be expressed, the number of individuals that need health services. I think that's soon to follow.
Awesome. Go ahead, Desmond. I know you were looking forward to contributing.
Yeah, I just want to piggyback off of what they said because this pandemic has really been stressful for everybody. And I think a lot of times people feel as though that you're a mental health professional, that, you know, you're kind of immune to this whole pandemic perspective. Like you have all the answers, you know how to, cope with this entire mechanism. But the truth is, like we're suffering just like everybody else. And although like we're giving resources to those who need it, we need to have those resources and those same resources get imparted back into us. And I know for me personally, just I would say this past year, just interviewing at different PhD programs for clinical psychology, specifically neuropsychology, and not being able to, go on a plane and have that, whole interview weekend with, professors and prospective students, and not being able to get that full, like, experience. So for me, like that was, you know, it was stressful, because it would have been nice to kind of have that. And then kind of just going off of what, Dr. Anthony just stated, many people, they lost a lot of family members, a lot of friends. And the sad part about that is not only did they lose those individuals, but the individuals that lost their lives, they died alone. They had nobody with them. They were just there in the hospital, or maybe they were at home, and nobody could actually come close, to hug them, to say, hey, I'm here with you. No matter what happens, I'm here to support you. So I think this pandemic has really played a huge role. It also played, light into other, situations within our country and across this nation. But I would say this pandemic for sure has really just taken a heavy hit on everybody.
Yeah, I think to all there's been a huge undercurrent that has also taken place during the pandemic. And from my perspective, I think mental health awareness has been um, amplified. I mean, I think the pandemic really served as a catalyst for people to not tiptoe into breaking the stigma of talking about mental health, but I think the ceiling or that barrier was broken, and it's like mental health awareness and the discussion of mental health is really prevalent, and I'm thankful for it. And these issues of mental health has always been a big priority, but the pandemic kind of served as a huge catalyst for it. And so here we are. Joshua, I did want to ask you, what can be done to help us address um, someone who has mental illness, or like how can we identify someone who potentially has a mental illness that's a byproduct of, say, something like the pandemic? And not to mention all of the other elements that came through the pandemic, with racial justice and things like that. How can we know if someone has potentially been triggered and it's in a place where there's a mental illness that either derived from the pandemic or like what type of signs can we look out for to help people get the help and aid that they need?
Right. Great question. I would say foundationally, who hasn't been triggered by this pandemic? Across the board, we've seen things this year that we haven't seen ever, ever. It's been probably saying this has been this past years is an understatement. But in terms of identifying, who may have a mental illness or who may be struggling with certain issues, I think is like within your relationships is to, I guess, really, really work on like stigma that is associated with mental health. So you definitely want to keep any kind of judgments or anything like that that would individuals from talking to you. It's probably one of the biggest reasons why a lot of family members don't realize, family members or realize that are suffering or are dealing with things, because those individuals don't feel comfortable. They don't feel like there is a safe space, communication. So have open lines of communication. don't judge, give your friend, family a safe space. Now, if we're talking about somebody that lives very close with you, like there are some things that are easier to see than others. Like um, you can tell, like if your family um, isn't eating as much, if there's changes, like you can see if they are in a lot of weight, if they're gaining a lot of weight, changes in their sleep pattern that may be excuse me, that may give a hint that something is going on with them. There are other things. Um, there are other things such as their concentration, their ability to remember things, their energy level. You can notice if you have somebody that's usually very energetic and then all of a sudden they're always fatigued. Those are things to pay attention. And then also, people, don't be afraid to talk about like um, wrong with asking, a friend or family member that you're worried about if they've had suicidal thoughts, if they've research has shown that asking those uh, is the risk of a person actually committing suicide or harming themselves. And a lot of times, individuals they want to be able to share those things. Um, we have to recognize that it can be extremely hard for anybody to share those sentiments. So just be open and be pay attention.
Yeah, that's good. So you kind of laid out what we can look for, and I think tail end of that you were doing a good job of figuring out ways that we can aid. And Desmond, I want to come to you just understanding your approach, and is there anything that you can contribute on ways that we can support those around us who are showing signs of mental illness?
Yeah, absolutely. First off, I would just say just have a conversation. Don't just assume something is wrong. Don't, assume something's not wrong. Just have a conversation with the individual or individuals that you suspect that something is not right. And usually that's how I tend to approach my situations because we get a lot of information from individuals when we just have just a rich conversation. It can be a small conversation. Sometimes you may not get as much out of the individual that you would like or have hope to have gotten, but hey, that's okay. It's a start. And the more you ask, the more you continue to keep speaking with them, then the more information you're study collecting on your part, then now it's like this big puzzle that you couldn't put together. Now you're kind of putting this piece together here and then this piece together here. It's like, okay, I don't understand exactly what all is going on, but I can kind of get a picture now of what's really taking place in this individual's life. So maybe this is what I should do. And I would say that after having conversations with the individual, trying to gauge where they're at, I would say just, hey, say, hey, you ever thought about, talking with a therapist or, going to a mental health, professional and discuss these issues and, try to take it from there because I think a lot of times many people mean well. And, a lot of times we get, like overzealous and we think that we're doing the right thing for, our family members or our friends and say, hey, I tried to get this, whole mental health, therapy session set up for you. So why don't you go, I think it'd do you some good. But all the while it's like, no, like you should not have done that. Always consult with the individual that you're, trying to help because, you know, it can go really, really bad, and just out of luck, maybe it can go right. But you never want to take chances with that, especially when you're dealing with mental health, because if somebody is on the verge of committing suicide or the like, always speak with that person, especially if you have a good rapport with them. So I would say just have those conversations, I wouldn't say as often as possible, but just enough where you can kind of gauge where they're at. So you know how to come in and how to support them the best way that they need to be supported.
That's good. I appreciate this streamline of thought that we should take in terms of supporting those in our lives. And the fact that if you're watching this or if you're listening to this, then we can get a cue from a professional. The reality is that a great majority of people are taking their cues from social media or media outlets in general, right? Music, IG, Twitter, shows. And so, Joseph, I want to ask you, do you think that mental health or mental illness, I should say, is being portrayed accurately in the media?
It almost makes mental illness, it puts it in like very concrete types. It's like, okay, mental illness only looks like this in these certain situations and circumstances, when it can be a whole plethora of, like, just it's a large range of symptoms, scenarios, what it looks like in different people based on their coping styles, their cultural upbringing. Like, there's all different types of ways that it shows up in real life. But TV, radio, media only makes it look a certain way. So what a lot of people do is, if I look on TV and I see depression looking a certain way, but that does not look like how my partner or my child is exhibiting it, I'm not going to ask, because if they did have it, then they would be displaying these type of symptoms. But that's not true. People are very unique. Everybody is a one of one. It doesn't matter what intervention I use. I can say, hey, here's one intervention that we can use to deal with anxiety. It's going to be applied 10 different ways with 10 different people, even though it's the same intervention. So I think it doesn't allow for the uniqueness of people, which also prevents the different ranges and ways that mental illness shows up in everyday life. So in essence, in everyday life, people don't know what it really looks like. They have a archetype based on what the media has portrayed on what it looks like, which makes a lot of people miss what's happening in the real world. So I think that's how media, especially TV, kind of skews what mental illness looks like in the real world.
Yeah, that's
Can I
good.
add to what Joseph just said?
Please, please.
I just want to add on, like, I agree completely with what he said. And I think with that, a lot of people look for mental illness, mental health to present as an individual losing, becoming non-functional. And we don't realize that there are a lot of functioning people that are dealing with mental health illness. Not only that, as I said in the beginning, that, like, at some point, within the lifespan, everybody probably has some struggle with mental illness the same way they do with physical illness, or physical health. And that is actually the same way we need to maintain our mental health, kind of, parallel to that. So I just want to agree with Joseph, because absolutely on the media, what is this usually very decline in a person, and a lot of times that's not what we see in real life, and by the time we do recognize it, sometimes it's too late.
Desmond, I'm about to come to you in a second, but in just listening to those responses, I'm curious to see, I'll be remiss to not mention that or bring attention that this is a panel of 3 Black male mental health professionals. And so I'm curious to know, in terms of whether it's mental illness or mental health in general, like, if you had to, let's make this a quick rapid fire round, like in 30 seconds, like, what is your value add or contribution um, to appropriately or properly portraying either what mental illness or mental health in general looks like, and how we can point signs to that? Like, how do you contribute to that in the social media perspective? And I'm giving you all 30 seconds on that.
Sure. I would say, first off, we have to debunk what, people think mental health is. Goes back to what Joseph said. It's nothing like what we see on TV, nothing like that at all. It's really, it depends on the person. It depends on what the situation is. It depends on what the person is exhibiting, what they're feeling. And I know for me personally, whenever I go on social media, I try to make an attempt to address specific issues, because I think a lot of times many people have no education about how to help somebody who's in mental distress. And they think they're doing the right thing, like I said before, they think they're doing the right thing, but all the while they're actually making the situation much worse. So I think, just being able to educate people and I guess have them to understand that mental health is a spectrum, then yeah. So yeah, to answer your question.
Okay.
No,
30.
and I'll say I just give psychoeducation. I don't want to necessarily have to fight with people over social media about what is, but I'd rather put out more positive information so people can access it. Social media is one of the most searched uh tools that we have for information on anything. So I just want to put out more positive and more informative information about mental health so that if people are going to be there anyway, at least if they're scrolling, they can see something positive about what the reality is versus what media has portrayed it to be.
On my platform, I just give people an opportunity to share their individuals. I definitely believe in being transparent. So a lot of times I share my own personal experiences with mental health as a provider and just as a regular person. I share stories about experiences that I've had experiences that I've had with family members with substance use disorder, whatever the case may be. And I give other people the opportunity to do that because as was mentioned earlier, mental health, mental illness presents differently in everybody. So someone may not be able to speak to what someone else is experiencing, but they can speak to their own experience. And by sharing their own experience, they can help someone else.
Hey, you saw that 5 coming. I saw smooth, smooth, smooth. Yeah, I appreciate that array of perspectives in terms of how you all show up. So Desmond, I know we just hearing that mental health is a spectrum. It is a spectrum. It's not a one size fit all. So we got that. We understand that perspective. But then I want to ask go with me. Is there a most prevalent mental health related concern that we should be aware of, or that you see that's facing I want to get specific, our community? And by community, I mean Black males or Black youth or BIPOC, depending on what type of terminology you want to use here. But is there a prevalent mental health concern that is on your radar?
When you first asked that question, I was going to say no, but when you said specifically for the Black community, that made me think. And I think, and I have no scientific evidence-based theory to back this up. This is only anecdotal evidence for me. And I believe I'm 100% correct in this assumption, but I believe for the Black community, I think a lot of us may suffer from PTSD, some type of trauma. And the reason why I say that is because we have to deal with things other races don't have to deal with. And, a lot of times people, when they, group all of us together, when they say Black, Indigenous, people of color, is the reason why we give that acronym. Because when you start lumping everybody into one group, you're not able to tease apart the specifics. And I know for us as a Black community, especially Black males, I'm really happy to be a part of this panel for one, but we don't really see too many Black males in the mental health profession. We don't see Black males really getting that much help, or anybody within the Black community. And I want to debunk something right here, right now. Many times we hear on social media, TV, whatever, they say, oh, Black people, they don't like mental health, or they despise mental health. Well, no, actually, that's not true. And I'm saying this, and I'm going to be very candid, be very, very candid. And I'm not trying to offend anybody, so I apologize in advance. When you look at the profession of mental health, who makes up the mental health profession? It's a predominantly white field. So when we talk about mental health and we talk about the historical context in which Black people were used as experiments, or they were experimented on, and then you kind of broaden that whole scope into the medical field as well. Then it kind of goes into like the vaccine with COVID-19, right? But to bring it back to mental health, it's not to say that Black people don't like mental health resources. It's the fact that when we look at the people who make up the mental health field, it's like, how can we trust our white counterparts? Because so many times we've been, done wrong. We've been having our trust, not there. And people who mean well, they try to understand us in therapy sessions, what have you, but it's like, deep down on the inside, it's like, no, you don't really understand where I'm coming from. So I'm gonna do you and myself a favor. I'm gonna cut this short. So all that to say that no, Black people are not immune to mental health resources. We're here to stay, but I think it's important to have people that look like us to be on the in the forefront of the field.
Man, so trailblazing response, and I see Joseph over there rubbing his hand. I'm gonna let you get in, but I got a question that I think really aligns with Desmond's response and will allow you to kind of elaborate. So I'm really curious to know, in what ways have you experienced a person's culture, religion, or some aspect of their background have an influence on how they think about mental health?
So me?
Yes, sir.
Yeah. So there, so I used to work for an agency where we did in-home therapy, and there will be times where I would show up as a Black male to a other ethnicity's home, and they would ask for all of my licensing information. I would get the third degree, as if I did not know what I was doing, questioning every single thing, every survey, every questionnaire. What is this for? Why does it? I would just get the third degree, like, so much so that it was almost nearly impossible for me to actually work with the family. And I think that is just indicative of just how society has viewed us. I want to go back to what Desmond said. Like, I think PTSD is one of the largest mental health challenges that African Americans face because of white supremacy. And I'm in a PhD program. I'm actually doing research on how Black couples can actually bond and work together and grow in their relationship while being under a system of white supremacy. There's actually research that proves what Desmond is saying, that we are experiencing PTSD at an extremely high rate, but the media doesn't always portray high functioning PTSD. We are still going to work. We are still raising our families. We are still getting into degree programs. We're still pushing through, all with PTSD, but you wouldn't see it on the surface. No. So I think for many African Americans who are in this country, we are suffering from a lot of PTSD, and there is research showing that it's pointing to that. That is one of the main primary sources. And I just wonder what our overall health would look like if we could eliminate that from the equation.
I'm just gonna leave the floor. Exactly. And that's why I'm gonna leave the floor open, because you're on my nerve right now, man.
Yeah, that's heavy.
You just gotta let it breathe. Go ahead.
Yeah.
Well,
man. So, I'm part of American Psychiatric Association, and we've been taking steps to address the history of white supremacy and racism within psychiatry, and that starts with acknowledging, foundationally, how psychiatry has contributed to mistreatment, subjugation, and PTSD of Black people and African Americans. And so for me, working within the mental health field, it is completely understandable why at times there is hesitation within the Black community to interact with certain mental health resources. Because usually, as Desmond said, you're not see somebody that looks like you when you go. A lot of individuals have dealt with being misdiagnosed. We know that African Americans are diagnosed with schizophrenia. Over 2 times more Black males are diagnosed with schizophrenia, around 5 times more than white males. And this goes all the way to the civil rights era, where um, was used as the diagnosis for civil rights protesters, psychosis. Before that, definitely psychiatry kind of justify um, the need for to be controlled, you know, under the pretense of being biologically unfit, morally inferior. And so that has continued to today where, unfortunately, when we talk about, provider is, we don't have enough culturally competent providers. And so the things that they see as aggression or inappropriate, I may just see as, be normal. There have been a few patients that I've seen with diagnoses, and I have no idea why they were given the diagnosis. And what makes it worse is that a lot of patients follow these diagnoses, and then the medications don't work. They may not really need them, and then patient feels worse. They've kind of returning for in the future. So that is the reality of where we are, and that's why you always encourage more Black people to enter the matter. And what we just need more people so that we can take care of our community.
Hey, Aaron, I'm sorry, I don't mean to cut you off. Just quick 2 bullet points off of what off of what Dr. Anthony has said. I think it's so important because when you talk about the field of psychiatry, because of course the DSM-5 comes from psychiatry, we have to think about who's making up these diagnoses, right? Who's labeling, okay, who's going to be schizophrenic, right? And I think when you approach the DSM-5, because I think right now they're, you can correct me if I'm incorrect, Dr. Anthony, I think they're on their way to make another DSM. Is that correct? Mm-hmm. And I was one of the individuals that was making mention about this on Twitter. I said, hey, I think it'd be a good idea to kind of have a multicultural perspective and have people from different backgrounds who make up different racial backgrounds, and to have everybody come together so we can make sure that when people are given a diagnosis, they're not being misdiagnosed as schizophrenic, for example, or bipolar. How about we just actually have a normal conversation with these people, and like Dr. Anthony said, just understand that these are normal functioning people, or if they're not normal functioning, this is something that's attributed to their culture. So you may not understand their culture, but it doesn't mean because their culture is a diagnosis. You know what I mean? That's the first bullet point. Second bullet point is, I was just thinking about this past presentation that I did at the International Neuropsychological Society. And long story short, it was this one young lady who did an excellent presentation. She gave a scenario with a white clinical neuropsychologist and an older Black lady, right? They were in a session. He was administering a neuropsychological assessment to her, but she was completely shut down. It was nothing wrong with her. It's just she didn't feel comfortable to trust him. And out of that, the clinical neuropsychologist, the white male, he thought that she was being, well, I guess he just thought that something was wrong. But another Black male psychologist had to come in and to let him know, like, hey, no, like, there's nothing wrong with her. Let me talk with her. And once he talked with her, he got so much rich information from her that the white neuropsychologist could not get. So all that to say that we really need like more Black people in the mental health profession, whether it be psychiatry, neuropsychology, social work, what have you. We need that because it's really important for our community to get these resources out there.
Man, you all have said a lot, and Desmond, I'm not going to let you cheat the general audience like myself, and so I went ahead and looked this up. So the DSM-5 It's the Diagnostic and Statistical Manual of Mental Disorder. That's what you were referencing, correct?
Correct.
And I think even when looking at that briefly, it's often we find ourselves, or we find ourselves having to be diagnosed from material that was created on a white or majority lens. And I think a lot of what you are said, I think about Black men specifically, but thinking about how do we get to a place where we're making decisions and writing material based on an equity lens opposed to a white majority lens. Then there was something else that I got to call him Dr. Anthony now, because you just switched the game up on me. Put a little respect on his name. But it's so interesting. You mentioned, you were talking about cultural competency, Sam. I'll just speak for me, like that can be frustrating when you think about some professionals. It goes across the board into other industries, but I'll stay here right now. But you think about these high functioning professionals who you all are intelligent people to go and get your MDs and PhDs and all this research and study. And you think about, well, what about a 2 to 3 or 4 or an 8-hour cultural competency course that could really change the mindset? And it does pose the question of if folks are taking these courses and it's in one ear and out the other ear to satisfy requirements, or if they're just not getting it, or if they're not interested in it. And the reason that it becomes a challenge because as a Black male, if I go and see any type of health provider, then I want that person, that professional, to be culturally competent as well. And I just found a new Black male PCP here in Nashville.
Wow.
And that takes so much effort. And if they're any good, they're going to be booked, right? And so I just want to endorse that more folks of color join the mental health profession. Joseph, I'm coming to you, and because you talked about going into folks' homes and doing visits and how you were treated and your experiences. I'm interested to know, how do you determine, or how should we determine if someone needs to see a therapist, if it's the time? I'll go there. I actually have a follow up, but you got to answer the question to get a follow up. So
Yeah. And I mostly do family therapy. So I usually help parents or even teens who come into the office. And one of the main thing is being aware of people's behaviors, their mood. Are they deviating from what they normally do? If your partner normally likes going out, exercising, doing stuff, but now they're only in the bed, that's the time to start inquiring. Are they stopping doing things that normally bring them pleasure? That's usually one of the first signs. Also and here's another thing, people have to be more present with people to even notice that something's wrong. We are in a social media era where everybody's like this. I'll be in sessions where kids will be like, I told my mom 5 times that I'm thinking about hurting myself, and she just didn't think I was serious. And mom was like, oh, I didn't realize that's what they were saying. But what really happened was they were distracted with work. They have their own social life. We're always trying to do our own thing or just have other stuff going on. But being present, that's how you can really be aware if something is wrong with somebody. It's hard to do that on a very superficial level because a lot of people don't always want to show that side. But someone who is watching, someone who is very intentional about our conversation, I give you eye contact, I can tell when you're shying away from certain conversations, that's when you can really start going deeper and inquiring. But that big one is, are people deviating from what they normally like doing and enjoy doing? And are they starting to have other habits or behaviors that are not beneficial to their overall health? Whether it's not going to work, whether it's poor hygiene, whether it's their diet, which is another one. We don't talk enough about emotional eating and things of that nature. Those kind of things are ways that you could tell that someone may have some type of challenge that they're experiencing.
And Dr. Anthony, is there a better approach between medication or therapy when treating mental health conditions?
Yeah, so that's a great question. And I thought about it a little bit. I know that medication usually has a gap within our community. It was actually one I almost didn't go into psychiatry is because my impression was that, hey, pill pushers. Um, I found out that was actually not the case when I entered the field, but I would say that medication works best for those who need it. And by that, what I mean is, a lot of times people are prescribed medication that they don't need. People are diagnosed, especially if we're talking about people of color. And so what happens a lot of times is that individuals do receive medication don't need. But most of the time, when we are prescribing medication, we usually prescribe a combination of um, medication and some form of psychotherapy or talk therapy. So those things usually work very well in conjunction together. So it's not necessarily a matter of, for us, which one is better than the other. I will say that with medication, at least focus on the biological causes of mental health disease. The purpose of medication that we give a lot of times is to balance neurotransmitters a lot of time, or to correct imbalances that may have occurred because of either environmental causes or because of just pure biological causes. And usually when we prescribe medication, it's because the symptoms or the presentation of a particular disease has become severe enough medication. Um, in terms of therapy, talk therapy, I would say it would be awesome if that was approached the same way we approach annual wellness. If you had, at minimum an annual, therapeutic check, or just a time to get screening by a mental health provider once a year, then that will make it so much easier to identify things that can actually be addressed before the need for medication actually arises.
Lead the way. Teach us, man. Teach us. That's really good. Note to self. I'm gonna switch it up here a little bit and toss this out to all of our panelists. And I'm curious to know. I've been curious this whole panelist, obviously, but curious to know: is it possible to predict suicide?
I guess I'll take a stab at that. I think in a lot of ways, yes. Of course, not all the time, because sometimes, people can exhibit no symptoms, or at least observable symptoms, I should say. And I've dealt with quite a few people who have went through suicidal ideation or was actually at the attempt of committing suicide. And from my own personal experience with these individuals, it can be very scary, because you're dealing with something that is so fragile. The way I like to think about suicide is like a glass vase, so like you're kind of putting it in your hands, and you got to be very, very careful, because if you shift your body a certain way, if you jerk or move or do anything of that nature, if it falls on the ground, that's it. You're not getting that back. And of course you can always, piece together, but this is a human life we're talking about. So that's a completely different story. And I say that because I dealt with quite a few individuals who had these issues. And one of the things I found very helpful was just spending time with the individual, talking to them. It goes back to the whole conversation piece. Of course, it's not a one size fit all, because sometimes you can do all the talking in the world and you may really think you're getting some headway with this. And then before you know it, it's like, snap, that's it, and they're gone. And that can be very sad. Thankfully, I've never encountered the individuals that actually, went through with suicide. But I would say one of the things that I really try to look for is what, Joseph said. Where's the deviation at? Is there a deviation from, this person's normal behavior? Are they withdrawing from other people? Are they being extra social? So you got to pay attention to like that side of the spectrum too, because sometimes like people say, oh, well, they're talking, they're jovial, they're happy, but wait, hold on. That's not really normal for me to see this person like this. So let me kind of check in and see, okay, are you okay? What's going on? So all that to say, suicide it's a very, very, very touchy subject, but it's something that really needs to be dealt with great care, I should say. So.
Well, let me just follow up and ask, because I know you said you hadn't dealt with a patient or a person who has actually committed suicide. Have you dealt with a patient or person who has attempted suicide?
Yes, absolutely. Absolutely. And it's, to make it very short and simple, it's one of those things where, like I said, you have to really treat it very delicately, because anything you say, it can push the person over the edge, and you could be like really well intentioned. So got to be careful how we really gauge that. I see Joseph want to get into this too. Go ahead, man.
No, I'm saying, like, no, you're hitting on all the points. And I think there are small breadcrumbs that show that someone is leaning in that direction, but it is really hard to tell who's going to go through and make with an attempt and who's not. Because anytime I think there's a potential risk for suicide, I always ask. It's always a conversation. It comes straight out. I don't sugarcoat it. I don't beat around the bush. I ask directly. And that way, what I've heard from a lot of clients is, wow, no one's ever came out and just asked me directly. Like, I've hinted and people get nervous and don't want to really say anything, but asking directly, and that's, anybody can do that. You don't have to be a professional to ask, hey, are you in a headspace where you're thinking about hurting yourself, and then contacting somebody else. And it's really like, I don't know what the stats are. Like, I'll have people, like you said, who are really contemplating doing it and never get to that point. But some people are like, well, it was just a thought, and then they really do go through with an attempt. So I don't think there's any sure way to be able to predict who's going to go through with an attempt or not. But I think the important thing is being available to them while they're processing that, and even after, just being there. Like you said, the perfect thing. I'm not there after the attempt to say what was right, what was wrong, why didn't you tell me? I'm there to be with you in that moment. And that's what people really need, is at that moment, someone to see me as a person and be willing to sit there with me in my mess. There's so much value in sitting with people in their mess, rather than, okay, we're in some mess, let me start cleaning up. Because that's what we want to do, because in all honesty, it can be uncomfortable for us, rather more uncomfortable for them to sit in it at that moment. So I think just being there with them in that, it can be tough, but it goes a long way.
That's some good advice. What would you say for those who you know or have encountered who have made an attempt and chose life, just for a ray of hope? Are there reasons, specific reasons that made them choose life? Is it because of the intervention? Do people tend to get close and then have a clairvoyance moment, or what is a reason that you've seen that people have decided to pull back?
So if I can jump in, I work with individuals who are contemplating suicide, individuals who have attempted suicide, sometimes several times, quite a bit, both at the hospital and with the VA. A lot of, former military. It's pretty common that's actually a very large part of what we try to address whenever we see and take care of our patients. One thing that we ask our patients whenever we see our reasons do you have to live? Like, what are your reasons for living right now? It could be your children, it could be a relationship, job. It could be, your faith. So there are protective factors that we like to say. There are risks, and we usually cover a lot of those things when we talk to patients. One of the biggest risk factors: do you own any firearms? Do you own any lethal weapons? Things that would actually make you to die by suicide. Um, we address, support systems. Like, do you live alone or do you live with somebody? Do you have family members that, are able to come around you? Do you have a friend group to interact with? Times what we will see are individuals that necessarily have those systems in place. They are alone, or they just don't know how to communicate what they're seeing and or what they're feeling. And a lot of times it will be friends of individuals who actually call and alert mental health services or authorities that, hey, check, because I just talked to my friend. They sound very different, or they may have said that. So there are risk factors, but it's hard to predict as well. I also want to point out, I think part of the reason why there is difficulty is because when it comes to the language of suicide, how we approach suicide, we have to realize that it's looked at in a very religious context. Even how we phrase certain things, like when we say, a person committed suicide, like a lot of that framework comes directly from, within the realm of early Christianity. Suicide was an unforgivable sin, and if you suicide, then you automatically, that was a one-way ticket to hell, purgatory. So even though
So how should we refrain?
So and I think during National Suicide Month, like some colleagues actually talked about this quite a bit. Just understanding, I guess, the person's mindset. So I like to say, died by suicide and commit suicide. Also realizing that when we look at suicide in terms of, this person is being punished, or they're not thinking about anybody, instead of thinking about it from the perspective of, somebody doesn't want to be alive anymore, because most people usually don't just feel like they don't want to be alive anymore. A lot of people are trying to escape pain, and a lot of times they have routes, and they haven't been able to find from that pain or that torment or that suffering that they're. So once we start approaching it from a different perspective, it becomes a lot easier to start talking about it with individuals. They don't feel shame associated with it. And I also want to point that, suicide is mentioned in the Bible, especially not in the sense of it being a sin. So I think, that is also important to know when we talk about.
So as I prepare to land this plane in wrapping up this portion on suicide, just knee-jerk reaction, if you were talking to a friend or giving some quick advice, what would you say are best resources for suicide prevention? and that goes to anybody. It could be the 1-800 line. I mean, I'm not even looking. It doesn't have to be the most clinical response, but what do you believe is the best suicide prevention or resource?
I would say always have, excuse me, always have an outlet or someone that you can talk to, even if it's just one person. And I know that's kind of like the consistent theme that I keep saying throughout this entire process, but it's really key, because you get a lot of information with just talking to somebody. And I think that when you're able to have these conversations, whether it be with a family member, a friend, a schoolmate, a teacher, professor, what have you, whoever it is that you entrust with your information, talk to them and tell them, like, hey, these are my thoughts. This is what I'm thinking. This is what I'm feeling. I don't know what to do here. I'm looking for some help. Can you help me? Can you guide me in the right direction? Can you lead me to somebody that can provide me with those resources that I need? I think that's so important because many times, and I hate to say it like this because of the day and age that we live in, but it's unfortunately true. It goes back to what Joseph said. Many people are not present, right? And of course, that's not to put everybody in, one bag, but a lot of us are not present. So I said that to say this, you know, if like you're not really present with people, hey, just try to steer them in the right direction. Try to give them what they need. If you can't be that person for them, then find somebody else who can be that person for them. Because like I said, we're dealing with people's lives here. And, somebody's on the brink of contemplating, do I have any reason to live? Or, should I just end it right here? Is it worth it? Does anybody really care? So I would just say, just really try to have that conversation with somebody that you can trust. And if it's even like a religion, like if you're in Christianity or whatever your religion may be, hey, go to that. Go to whatever it is that's going to provide you with that strength and that source that you need in order to get yourself out of this. Because trust me, you don't have to deal with this alone. You're not in this alone. And so that's what I
And
was
real
saying.
quick, and support that you deem to be support, not support that is just offered. Because a lot of times we will give our support in a way that's convenient for us, or we'll share it in a way that may be easier to do for someone else. But the person who's receiving it has to feel like that is support.
Right.
So if you're a person that's also looking for support, be willing to seek support that identifies and aligns with you, what you need. And also, I want to hit on something Dr. Anthony said. One of the biggest protective factors is community, like having people around. Who can you immediately talk to when you get in this, when you start to feel like you're heading down that rabbit trail? Before you get there, who can help turn you in a different direction? That support is going to be like, it's invaluable. Like that, you need that support. So find support however it is. And also, one of the biggest protective factors is get people around you that you specifically trust, that you are willing to share your emotions with, and that can help you along that journey.
All right.
I just want to drop the number real quick. There is a suicide lifeline. So July 2022, this number will be available across the US, but it's 988. That will be the 911 for suicide prevention. But also, if that number hasn't been implemented in your region, there's another number, 1-800-273-TALK. It's 1-800-273-TALK. So if you don't have anyone else to talk to, those are definitely two resources that may be beneficial.
988. Okay. That's awesome. All right. So the last question goes to you, Dr. Anthony. And I know you talk a lot about the vaccine and its impact on the Black community in terms of this toss up on if we should or should not take it. And so I did want to give you an opportunity on this panel and tell us what information individuals should take into consideration when considering the vaccine.
Oh yeah, definitely. So first of all, this is a very charged subject in the Black community. Charged subject, my own family, and completely understandable. Has been subject to several instances experimentation and mistreatment on the Tuskegee experiment. So it's understandable when, you know, anybody tells me that they don't want to take the vaccine, fault them for that. I do encourage everybody um, be as educated as possible and stay as up to date with information as possible. And that means getting your information from trusted individuals and from trusted sources. Whenever we get information, colleagues included, we share information that has been um, researched and peer reviewed, that has gone through a whole lot of levels of scrutiny before published. So we try to make sure that we only give information that is reliable, in part because we know how much our community has been affected by, you know, medical mistreatment over the years. Now, myself, I did get the vaccine. I got December and January. I'm fine. I haven't had adverse reactions. Also, my initial reaction, I think I just needed to stay home from work for a day or something like that. My wife also got it. But at a baseline, you also need to realize one of the reasons, or the reasons why these vaccines even became as necessary as they were for community in general. We have a lot of underlying medical conditions that put us at higher risk of death from COVID-19. My mother caught COVID, the SARS-2 virus. I've never been sick in my life, and the way it hit her, and that I was not prepared for. I was definitely scared, fearful. So I definitely relate to, you know, feelings of anyone else who has hesitation. My first thought when I heard about this was, hell no, I'm not taking that, you know. So I understand, but you know, the other part of that that was troubling was that before the vaccine became available, individuals didn't want to, you know, wear masks. Individuals didn't want to socially distance. Individuals didn't want to wash their hands more. More or less, a lot of individuals didn't want to be told what to do, and that was the concerning part, because, you know, if you've noticed, along with, this period of us socially distancing and whatnot, the rate of the flu virus this year has down like quite a bit, just from us, like keeping a little bit of space in between us and wearing a mask and doing things like that. So I think if we would have followed those recommendations a little more closely, to be gotten to the point where we felt a vaccine was being on our throats or something like that. Take care of yourselves. Make sure you're getting proper nutrition. Make sure you're getting the right amount of. If you decide to get the vaccine, then definitely that's a choice that I encourage you to research and to make for the health of yourself and your family. Make sure that you're doing to stay healthy well.
Awesome. So we are at the end of our time. I want to thank you all, Dr. Anthony, Desmond, Joseph, for giving us your time today, for giving us your experience and perspective from your experience and your expertise. And thank you for being essential workers in this pandemic. Thank you for being the change that you want to see as far as being Black male professionals inside of the mental health field. We need more men like you to continue to push this agenda and this narrative forward. Thank you, Davon Breedlove, for allowing me to host this panel and for bringing us together and for raising awareness for Mental Health Awareness Month. So this has been fun. I hope that this panel discussion and this information really serves our community and communities at large across the board who are dealing with mental illnesses and working to be a value add to the mental health field and those who are suffering from mental illness. I'm Aaron McGee. It's been a real peace.